Hi, I'm Christopher Link, and last year I completed a fourth-year fellowship in HIV and viral hepatitis at the Wellness Center, a Ryan White recipient clinic at the Family Medicine Residency of Idaho and Boise. These are my 3 pearls for family physicians. Number 1, make routine HIV screening a regular part of your day-to-day practice. Both the CDC and the USPSTF recommend one-time opt-out screening for all adolescents and adults ages 13 to 64, even in the absence of identifiable risk factors, in addition to every pregnant patient during each pregnancy. For those with ongoing risk factors for HIV exposure, specifically men who have sex with men, those with partners of an uncertain serostatus, persons who inject drugs, those who engage in transactional sex for money or drugs, more frequent screening may be warranted. Consider acute HIV and the differential diagnosis for patients presenting with acute mono or flu-like symptoms, particularly if risk factors for acquisition over the preceding 4 weeks. Screen for HIV utilizing a 4th-generation combination antigen antibody test to increase the likelihood for picking up early disease. Given that an estimated 15% of all cases of HIV in the United States are currently undiagnosed, increased screening, early linkage to care, and appropriate initiation of antiretroviral therapy can not only decrease a patient's morbidity and mortality, but also reduce transmission and will aid in ending the epidemic. Number 2, for patients at ongoing risk for HIV exposure or acquisition, consider discussing pre-exposure prophylaxis or PrEP. PrEP is a highly effective and well-tolerated combination of 2 antiretroviral therapies combined in 1 tablet taken daily that can decrease the risk for HIV acquisition greater than 90%. In addition to previously mentioned risk factors for patients identifying as transgender or gender non-binary, particularly patients of color who are at high risk for HIV exposure, in addition to patients with a history of a sexually transmitted infection over the preceding 6 months, discussion regarding PrEP initiation is recommended. Both the CDC and likely your local public health department has additional details on PrEP discussions and linkage to medications. Number 3, screen all adults over the age of 18 for chronic hepatitis C. USPSTF has recently updated their recommendations, now recommending that all adults ages 18 to 79 be screened for evidence of chronic hepatitis C infection. This can be performed by obtaining a hepatitis C antibody, ideally reflexing to a hepatitis C viral load to confirm ongoing or chronic infection. The vast majority of chronic hepatitis C cases can be managed in the primary care setting, and for additional details regarding laboratories, imaging, recommended workup, and appropriate treatments, I would relay the listener to hcvguidelines.org. Thank you.